many hospitals currently being understaffed and are unable to respond to medical emergencies quickly because they don't have the capacity, pernicious vaccine mandates remain in place in most jurisdictions for frontline medical workers. But tonight, demonstrations have been held at hospitals in a number of major cities calling for vaccine mandates to be lifted to help bolster emergency services, to help you. Joining me now is Monica Smith, who has been there organising these demonstrations. Monica, great to see you as always. You're out there fighting for people's freedoms. More importantly, you're out there fighting for those health workers who we need not being allowed to work because of vaccine mandates. It is insane. Monica, tell us about it.
Well, it's interesting because it's not just about the workers who obviously their livelihoods have been affected, and a lot of them have actually gotten other jobs in fields that they're not trained for, but also it's actually endangering lives that they can't work. I heard a story of a woman who called 000. Her 2-year-old was struggling with croup, and she got a voice message saying they couldn't take her call. Can you imagine that? And so it's really about saving lives, which actually is ironically the reason they brought in the vaccine mandates. And really the interesting thing is we met with some public today, and I asked them, would you rather see an unvaccinated doctor straight away or wait 3 hours to see a vaccinated doctor? Everyone said, I would much prefer to see one sooner. So really, I wonder who is asking the patients about what they would prefer. And I will add in there as well, Rowan, it's not just about emergency services. Also, there are healthcare workers obviously answering 000, but there are also healthcare workers in disability support, in youth support, and some of them have been working with their patients in aged care for over 10 years, and all of a sudden they get ripped from their patients who are now their friends, and no one has asked the patient if they want that carer to stay unvaccinated. So there's a few facets here, but those are the main points.
Well, Monica, you've been very brave. You've right at the forefront of fighting against this, going right back into COVID. You and I spoke many, many months ago when, it was at the very height of it. I'm just going to play a bit from you speaking this evening to some of those health workers. Just have a listen.
We have just added the years of experience in healthcare just in this small group here, and there is 392 years of experience in this group. You cannot teach that in one university to one person. It is absolutely invaluable. Give these healthcare workers their jobs back. Some of them took the first two but didn't want to take the third. What do you think about that?
I think it's a disgrace. These people are essential. Look, I'm vaxxed only because I chose to get vaxxed. And everyone should have a choice with what they want to do with their body, and they should have control over that.
So, Monica, you will have heard earlier I was talking about Woolies, how they've dropped their vaccine mandate, even Woolies. So how on earth is it conscionable when people are crying out, as you said, we could be putting lives at risk because there aren't enough health workers in your own Victoria? Dan Andrews, clearly there are problems there with the ambulances and so on. And yet these mandates remain when we now know that Pfizer have admitted that they don't necessarily prevent transmission anyway. So the whole rationale has collapsed. Why are the mandates still in place, Monica?
To be honest, I can't give you that answer exactly, but I do want to rephrase what you said. Could be endangering lives. I'd want to say they definitely are. I mean, you saw with the floods here in Victoria recently that the SES workers had to be vaccinated. Now, if I was drowning, I tell you what, I don't care if the person saving me is vaccinated or not. So absolutely these mandates make no sense. And it could just be arrogance or pride that they don't want to backtrack on it. Daniel Andrews has actually announced a $5,000 incentive for nurses to study nursing when there are thousands of trained nurses that could literally walk into the hospital tomorrow. So it just makes no sense. But if you try to make sense of everything here in Victoria, Rowan, you would go crazy.
And exactly. You've got the election coming up in a couple of weeks, Monica. What's happening with your party there?
Oh, I don't have a party, so I'm just a lobby group, I guess. But, it's a real mess here with all the... there's a lot of the preference dealing here in Victoria. You're so lucky you don't have that in New South Wales. It really changes the game completely. So it's a bit of a dog's breakfast, I guess you could say. But I just hope that we get, realistically, the only thing that we can hope for is, of course, a few extra I guess you could say conservative or common sense voices in the upper house that can actually just stop legislation. So I'd be happy with just one or two more conservatives. That would really make a big difference. But we'll see what happens.
Now, Monica, you've got these protests. There are a couple more nights. They'll be at 4 major hospitals: Brisbane, Adelaide, Melbourne and Sydney. So we would urge people to go up and support them. They're peaceful. They're trained medical professionals who have been denied the ability to look after the Australian people simply because of mandates for which there is no now scientific justification. So what would you ask the public to say to show their support, Monica?
Well, absolutely. I mean, if you're a healthcare worker, you should definitely come on down at 7 p.m. for the next 2 nights in those 4 major cities. You can just go to the Reignite Democracy Australia website and find that. But from the public's point of view, we do have a survey on the website as well. We have over 28,000 responses, and 27,000 of those responses have agreed that they would be happy to take care from an unvaccinated carer. Over the next week or so, we will go to Plan B, which could be to petition Parliament and things like that. And hopefully, Rowan, you've set quite a standard with Woolworths. Karina came on your show and she got what she wanted. So I'll be expecting big things from this segment.
Absolutely, Monica. We're going to win. We are going to win. That health mandate, vaccine mandate must disappear for the health of all Australians. Thank you so much, Monica Smith. Great work. Coming up, I'll be chatting to Alex Stein.